Next speaker is from the University of Puerto Rico, Dr. Frances Ruiz Alfaro, Dr. Teófilo Espada-Brignoni, Dr. Edgardo Morales-Arandes, and their talk is From Spectrum to Palette, Reconceiving Psychotherapy and the Active Roles of Therapeutic Encounter. Over to you.
Okay, so can you hear me now?
Yes.
Thank you. So I'll be presenting. My other colleagues are here as well. So on the area of questions, maybe they can, gather the input. So I want to first get everyone to be on my time zone. It's 9 a.m. and we're going to go on this small trip to Puerto Rico. So that's why we have a few of these pictures so that you could better grasp where I'm speaking from. So simplicity and avoiding ambiguities are staples of Western culture and thought. Traditional positivist psychology stories invisibilize indigenous African and scholarly knowledge and practices that emerge in different cultures to make sense of the human experience, including our understanding of joy and suffering. By considering language and subjectivity, psychoanalysis explores how individuals make sense of their lives. Furthermore, authors such as Harry Stack Sullivan, Erik Erikson, Enrique Pichon Riviere, and others have recognized social pressures and the complex dialectic relationship between the social and the individual. As Gastambide argued, the premise of psychoanalysis should not be an unconscious solely preoccupied with one's relations to others, but an unconscious that exists in a matrix of political economic relationships, textured by race, class, gender, and sexuality within a racial capitalist world, end quote. Unlike European and North American psychology, Latin American and Caribbean psychology exists at the crossings of theories and practices exported by the North, as well as the indigenous cosmovisions, popular culture, and local scholarly fields. For example, in our colonized archipelago of Puerto Rico, the roots of psychological thinking can be traced to the beliefs and practices of indigenous populations, enslaved people forcibly brought from Africa, pedagogical theories, medical doctors adapting scientific knowledge to local contexts, and the literary and social scientific traditions of the Caribbean and Latin America. Translating dilemmas, theories, and concepts developed in North American society not only reproduces solutions not adapted to singular contexts, but it also trains future psychologists and therapists through textbooks and seminal readings to reify white, educated, industrialized, rich, and democratic cultural frameworks. In the context of psychological assessment in Puerto Rico, Puerto Rican intelligence was assessed using testing items that came from the United States. And those items usually asked about the color of the snow and the average height of the United States men, while living in this oldest colony in the Caribbean. Despite acknowledging psychology's role in this social injustice, recent assessment tools fail to truly understand the diversity and complexity of Hispanic Latino communities, treating them as a homogeneous group. Generalized Western ideas, such as the Puerto Rican syndrome, have been imposed through imperialistic taxonomies. The United States military adopted this concept in an attempt to associate mental illness with a specific cultural group only because the performative expression of stress was not consistent with that of the empire. Metaphors such as Evelyn Foxkeller, Ronald Lang, Andrew Pickering, and others have noted drive theory, research, and practice. By thinking about our psychological concepts as metaphors, we can consider the dynamics and relationships they silently reproduce while proposing metaphors that inspire practitioners to reimagine what we have taken for granted. As Keller analyzes the Sleeping Beauty metaphor, which upheld Western's misogyny, drove researchers to theorize fertilization under the working assumption that the male sexual cells were active while female cells were passive. A shift in this metaphor allowed cell biology to move beyond the idea of male sexual cells that have control of female cells. Our proposal for a shift in the use of the metaphor of the spectrum in psychology seeks to promote collaborative conceptualizations. Originally from the Latin speciere suggesting to look, the spectrum concept has transformed and evolved in multiple ways that consistently try to produce pre-existing categories for subjective experiences. Spectrum as a metaphor suggests the idea of a color grading one-dimensional reality, which in turn intentionally or unintentionally silences uncertainty and diversity. In the context of electromagnetic rays, the idea of spectrum proposes the ranges of all types of radiation. However, considering that every possible electromagnetic radiation in the universe is already included in this continuum, would be a simplistic approach to the infinite scope of scientific knowledge. The DSM and the ICD publications have historically reproduced taxonomies to classify subjectivities. In a timid recognition of the impossible task of reducing the irreducible, the recent editions of these publications have employed a dimensional approach to diagnostic criteria. These editions employ the spectrum metaphor to recognize variations in clinical symptomatology. From schizophrenia spectrum and other psychotic disorders to autism spectrum disorder, the DSM has turned the spectrum into an all-encompassing metaphor. In their attempt to provide more nuance, they end up flattening the multicolored and multi-layered complexity of human experience. This all-inclusive approach to diagnosis fosters the idea of generalization and predictability across a single dimension grounded in positivist epistemologies. Spectrum as a tool denies invisibilizes the true variability of human experience, which does not exist as magnitudes across a single dimension. This spectrum reinforces taxonomical boundaries and reifies diagnosis, reducing it to essentialist positivist categories and attributes. This simplistic diagnostic view conceptualizes criteria through functioning level and symptom severity. This individualistic and mechanistic approach does not recognize a person's strengths, interests, relational bonds, social, political, and cultural context. A collaborative approach to psychotherapy would distance from this universal language that ceases to allow a clinician, therapist, or evaluator to consider the voices, history, values, and experiences embedded in a person's self. As Kenneth Gergen argues, these categories represent implicit, unquestioned agreements of desirable behavior. These have at times been challenged and problematized by communities, social movements, minority groups, and perspectives such as cultural psychology, indigenous psychology, critical social psychology, and social constructionism, among others, who have questioned the taxonomic and essentialist assumptions of traditional Western psychology, while arguing in favor of other ways of seeing, thinking, and dialoguing. We propose then the palette as a metaphor, combining the diminutive conjugation of the French pail, shovel, and the Latin pala, spade. The word palette produces a tangible concept that acquires meaning through its active uses. Through a generative perspective of application and collaboration, the palette recognizes the action and creativity embedded in the performer, usually a painter. This viewpoint generates multiple possibilities for transcending dichotomic approaches to subjectivity. As a collaborative tool, the palette will allow clinicians and interlocutors to reappropriate and produce new shared meanings. We suggest the metaphor of the palette as an alternative to other metaphors used before, machine, computer, spectrum, to think about and engage in dialogical relations with their interlocutors as multi-beings. The spectrum view hides the agency of psychologists in the process of diagnosing and positions the interlocutors as passive recipients of pathological discourses. The spectrum turns the job of the psychologist into a mechanical, technical one. On the other hand, the metaphor of the palette highlights the agency of the psychologists who are responsible for partly constructing a whole image and their interlocutors of what a loaded word such as autism might mean. The palette holds not only whichever color or diagnosis the psychologist would communicate, but also a multiplicity of terms, perspectives, possibilities, and choices to employ to better understand a singular human being, going beyond diagnosis and integrating community, art, and culture. This approach recognizes the professional language of the psych disciplines. However, instead of focusing on functioning levels on severity, it focuses on singularity, talents, strengths, and compass in a relational system. Our proposal dialogues with relational narrative and affirmative interventions that transcend specific theorizations, opting for a political and ethical stance. Psychotherapy yields a singular experience from a collective encounter. As Gergen argues, there is no process of therapy in itself. Therapy comes to be what it is within a matrix of a relationship, end quote. In the context of clinical practice, graduate students as early practitioners have encountered moments of stuckness, disbelief, and questions if their labor is in fact psychotherapy. The authors, we are professors at the University of Puerto Rico and supervise students in clinical psychology and social community psychology. And even after hearing words of gratitude and newfound meaning from their interlocutors, students find themselves confused, reflecting on their take on this new role as a therapist. As supervisors in psychology, we have encountered several graduate students in this situation throughout the years. The uncertainty and unscriptedness of a therapeutic encounter find meaning only through the encounter of the multi-beings, fostering shared meanings. Recognizing subjectivity as a simultaneously singular and collective experience has been a challenge for those who still argue for generalization and predictability of uncertainty. Even after acknowledging the need for a person-centered approach in evidence-based psychotherapy, the monolized one-dimensional performance of therapy has been widely employed. Reconceiving psychotherapy and the active roles in therapeutic encounters recognizes and embraces the juxtaposition of multiple dimensions, including the therapist and their interlocutors. Urging for a humble approach to the therapist's role in this co-created space that we call therapy promotes a respectful space that fosters reflection and flexibility. To engage in a meaningful collaborative relationship with patients and interlocutors, psychologists need to be aware of the asymmetric power relationships with patients and interlocutors. Psychologists need to be and know that these power relations that pre-exist the therapeutic encounter. Words such as Asperger and autism carry with them the weight of science and social stigmas, even when uttered with the best intentions. As such, therapeutic and diagnostic encounters can reinforce the sociocultural pressures to conform to public and academic psychological standards of behavior. To challenge this, psychologists must consider a delicate balance where they can understand their power, regardless of whether they see themselves as individuals with power, and use their power to engage in a relationship with their interlocutors that empowers them, despite the temptations all parties might have on conducting business as usual. Recognizing that our interlocutors are sometimes government, funding agencies, and insurance providers, we do not suggest entirely abandoning the spectrum language, since it is still needed for therapists to be understood by the establishment. However, a collaborative approach to psychotherapy calls for a therapist to embrace uncertainty, curiosity, and ambiguity, allowing interconnections and reflections to arise through language, silence, gaze, sighs, tears, and laughter beyond the pathological use of language. This approach requires curiosity to question socially sustained prejudices and uncertainty to foster the connection with the interlocutor's time and space. This a therapeutic encounter that initiates with the psychotherapist reading of a referral note or a dossier is plagued by preconceptions that do not allow for alternate interpretations or the active voices of the person seeking therapy. A palette approach widens the scope to recognize a collaborative opportunity within the inescapable unequal dynamics that conform a therapeutic encounter. In Puerto Rico, Western ideas and conceptualizations of what constitutes a therapeutic encounter have had to be signified and resignified through opportunities in the fate of natural, pandemic, hurricanes, and political disasters. This has required us to provide support to individuals, and communities. Sometimes we work with a municipality on the island that has a lot of floodings, and the work that we have done with other psychologists, clinical, social, and professors and students has been to require to provide support and resources, not by imposing their interpretation of the community's needs, but by being ethically present, even if that meant developing makeshift therapeutic rooms that still had mud-covered walls as a contact active memory of the recent floodings. As I conclude, these diverse colors and textures initially separated in the painter's palette acquire meaning through the singular combination of multiple hues interconnected in that moment. Similarly, in psychotherapy, what acquires meaning and reflection for someone can only be conveyed by their relational performance, including the individual and collective history produced in that 60-minute session. A new shared language is relationally produced in each encounter through gazes, gestures, and dialogue. Therapeutic encounters reject predictability, challenging us to embrace the transformative potential of intentional ambiguities, uncertainties, and curiosities. A therapist can co-gather, co-create, co-discover new hues that promote reflection, navigating the unpredictable paths of relational performance. Thank you.
Thank you so much. We have a few minutes for questions or thoughts, comments. If anyone wants to jump in or raise their hands.
I don't know if the beach was a little distracting.
There's so much in what you're saying.
Yeah.
A minute to...
Well, just wonder whether or not you mean there as been said, there's a lot, and it's very hard to sort of to try and think about it all very quickly. But you were saying something towards the end about being ethically present. I wonder if you could say something about what you mean by that.
Yeah, I think it's being aware that even the use of language, even with the side disciplines, we are we have a responsibility, an ethical responsibility that I think was discussed before, to be aware that how this language and how this optic of traditional and Western ideas can still suppress and continue the power dynamics that have been proposed and imposed by the establishment. And obviously, I'm talking from my perspective as a clinical psychologist in Puerto Rico, which is the oldest colony, in the Caribbean, from our relationships first with Spain, then with the United States. Psychology comes from Puerto Rico through others instead of our shared meanings and language. Yeah.
Thank you.
So would you see this as I don't think you use the word directly, but or is this sort of post-colonial then, finding your own voice is difficult with all of them.
Yeah, also I think what we talk to students, how easy it is to be seduced by this power discourses that we can find from even reading a referral note of a teacher for for services for a child, in which when we read that referral note, the use of diagnostic language is embedded in the ways in which this child is described, for example.
I think Eric's raised his hand, Jessica.
Yeah.
No, I can't see that.
Yeah. Can you hear me okay?
Yes.
Yeah.
Yeah, thanks very much for that talk. I was interested if you could talk a bit more about the indigenous traditions. So, you could extend it to there is indigenous science in Puerto Rico, as there are with other societies. There is a shamanic tradition. but how does that impact on your understanding of therapy? Does your understanding of therapy change? Does it differ from some of the Western traditions? Does it add to it?
Yeah, I think we have Santeria, Espiritismo, different other traditions that come from our indigenous ancestors. And in Puerto Rico, there's even a problem in the use of the language, because people have internalized the United States idea of desired behavior, for example. And when we talk about how we are these traditions of indigenous and other religions, polytheist religions are part of our culture, many people want to be distanced from that. And I think that's one of the problems that we encounter, how these other ideas on indigenous psychologies provide a space for us to see ourselves differently, instead of these dichotomic traditions that have been accepted by us from our imperialistic political relation.
So much. More.
Can I make a comment on that?
We should move on to the next talk. Maybe a quick comment.
Yes, and I just wanted to just give an example. There was an article published maybe about half a century ago that gave a very good description of that. There's a client that comes to a therapist, and he's talking about her mother that visited her last night. And when the as a therapist goes into ask more questions about it, it turns out her mother had died 10 years before. So she was talking about the experience she was having with her mother, and within a specific tradition in Puerto Rico, talking with dead relatives is sort of a normal kind of type of encounter that you would have. But from the perception of North American psychiatry, that would be an example of hallucination and psychosis.
Yeah.
Thank you so much for research and for your